everyone. Thank you so much for joining us today. My name is Sarah Howe, and I'm Mazik Global's Program Manager for Clinical Healthcare and IoT Technologies. Today, I'm going to moderate a discussion among three awesome panelists who have taken time out of their super busy schedules to be here with us. We're going to talk about the precision medicine movement, where it's headed, and what needs to happen to get there. Let me introduce our speakers. First, we have Tracy Picone, Microsoft's Director of Healthcare for Dynamics. She is responsible for driving all aspects of business development, including strategy, solutions, strategic partnerships, marketing, and sales. Tracy has vast experience in the healthcare industry as a private practice administrator and extensive experience working for one of the largest medical device manufacturers. She is passionate about bringing technology solutions to the healthcare industry. Drive precision through digital transformation for our customers. To further Mazik's mission, Syed guides Mazik's efforts to provide best-in-class products and services characterized by innovation and excellence. Last but not least, we have Patricia Becker, Mazik's Chief Strategy Officer. Pat has 25 years of executive healthcare information technology experience. She has previously served as CIO for University of Chicago Medical Center and University Health System Consortium. She is currently a HIMSS Fellow and adjunct faculty member at Northwestern University. I'm looking forward to a great, nuanced conversation with the different perspectives these panelists bring to the discussion. To start things off, let's establish the concept of precision medicine. The National Institutes of Health defines precision medicine as an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. This approach will allow doctors and researchers to predict more accurately which treatment and prevention strategies for a particular disease will work in which groups of people. It is in contrast to a one-size-fits-all approach, in which disease treatment and prevention strategies are developed for the average person with less consideration for the differences between individuals. Tracy, we would love to hear from you a bit more about the background of precision medicine and what the vision is for the healthcare industry around this concept.
Thanks, Sarah. I'll definitely delve into a bit of the history of precision medicine. And I just want to emphasize the need and challenges the healthcare industry is facing today. A recent study by a leading drug company indicated that 38 to 75% of patients today do not receive effective treatment due to a lack of individualized care strategies. And I think this highlights some of the inefficiencies in the way we approach healthcare today, whereas precision medicine is expected to improve patient health outcomes and save costs to providers and payers. And while definitions and understanding of precision medicine actually greatly vary, we do agree that the core of the concept revolves around personalized care. So precision medicine is about being able to classify people precisely based on their genomic makeup, but we do need to add in the environmental factors and lifestyle choices, and then take all of this personalized data and prevention for each patient, so that we can effectively apply all of that data and information to maximize the effect of a disease treatment for those individualized patients. And the journey, it's an interesting journey, right? The journey to personalized medicine is really going to cause a paradigm shift in care delivery, in patient participation, and direct-to-consumer initiatives. That one-size-fits-all approach in medicine does not work anymore, so it really leaves us, where are we at today? And the most progress in precision medicine has been in genomics, and there's been a dramatic decrease in the cost and time to sequence a genome. So for example, in 2001, the cost to sequence a genome was $100 million. Last year, in 2016, the cost was $1,000. And it is estimated that the human genomic data will generate 40 exabytes of data per year by 2025. So to put that in perspective, an exabyte is 10 to the 18th power, right? So it's a huge it's a huge amount of data that we are going to be generating and continue to generate. So not only has the cost and time to process genomic sequencing decreased, but we're now seeing direct-to-consumer marketing for genomics testing, right? So in 2001, $100 million, not available for individual patient. But in 2016, the cost dropping down to $1,000 makes it much more available, not to every patient, but to some patients. For example, right, in April, the FDA announced that it approved 23andMe to market directly to consumers. And 23andMe was, they delivered ancestry tests that you probably have heard about, but now they're offering personal genome services. And these types of clinical innovations are really driving down the cost of sequencing and becoming more commonly available, and may perhaps help patients to become more proactive in their own healthcare. But it would be a big mistake for us to equate precision medicine just solely with the genomics data, as that data is only one part of a more holistic view that we need. So precision medicine to be effective, we have to include social, lifestyle, and environmental cues. And just as importantly, we have to be able to integrate all this information, all this data into clinical innovations within the care delivery redesign.
Thank you, Tracy. This graphic here illustrates all of the different factors that go into one's health and gives the broader context besides genetics. Let's delve a little deeper into how precision medicine relates to each of these factors by going through each determinant one by one. First up, we have genetics. Tracy, would you like to take this one?
So as we'd mentioned, in the next several years, we're going to see an explosion of health-related data, right? We started with a focus on genomics, research around discovering and creating new pharmaceutical drugs, or a focus on developing care pathways that match the genetic markup of an individual. But we now know that precision medicine, it has to incorporate so much more than just the genomic side. So with the advent of digital healthcare solutions, has created a plethora of personalized health and lifestyle data, really a path towards healthcare consumerism. And today with this consumer engagement movement that we see in healthcare, people are more receptive to healthcare information and wanting to actively participate in their healthcare decision-making process. And I think these trends sync really well with the evolving precision medicine practice that aims to extend a sense of accountability to the patient and also their caregivers. A different sense of accountability. So for example, a patient brings in or emails their doctor data from their Fitbit. While this information, this data is very valuable, where is it supposed to go? How do we make it actionable? And it's not a symptom of providers not wanting the data. They do, really. But the struggle is, how do they keep up with the rapid advancements in technology in the genomic industry? How do they keep up with consumer expectations? How do they keep up with all of the data and synthesize it into something actionable? So there's several questions that emerge from here is just, what do we do with this much data? How do we synthesize the data? How do we make it actionable? But how do we secure this much data and this type of data? How do we keep it secure? So let's talk about just for a second what happened over the weekend with the WannaCrypt cyber attack, right? It brings to the forefront just how important it is to have proper security measures in place along with properly updated operating systems. The amount of data that precision medicine will generate, remember I said 10 to the 18th power, the number I mentioned, that's going to require critical attention to adopt to the high level privacy and security changes that precision medicine programs are going to require.
Thank you, Tracy. So this accountability that you mentioned, I think that's what we would consider part of the lifestyle choices that impact our health. I'd love to hear more about how our actions and decisions tie in with precision medicine. Pat, could we hear from you?
Sure. As we all know, lifestyle choices can have a major impact on one's health, whether it's the use of alcohol or tobacco use, or even inadequate activity, an unhealthy diet, even habits like how often you wash your hands. By changing just some of these factors, we can greatly reduce the rate of disease, especially chronic type illnesses. What is particularly interesting to me is that certain behaviors can interact with individual genes and trigger certain diseases. So one person might be diagnosed with type 2 diabetes because they continue to eat unhealthily, have an unhealthy diet, say, for maybe 5 years. Yet another person can have an unhealthy diet for 10 or 15 years and never get diagnosed with diabetes. So what is the factor that determines if one person gets diabetes and another person doesn't? That's where we're looking for genomics to assist us. But we also need to not only look at the genetic factors, but also the person's lifestyle when we're considering their illness.
Thanks, Pat. Yeah, I think it is worth noting that caregivers have to take our behavioral and lifestyle choices into consideration in order to create more precise care plans for us as individuals. Pat, could you give us more insight into how medical care relates to precision medicine and our health?
Sure. Another factor to think about is how much access a person has, not just to medical care, but sustained medical care. Because without access to sustained medical care, how effectively is their treatment going to be? Lack of this access can deter a person from participating even in preventive care activities, such as a yearly mammogram or even a yearly flu shot, or they can delay treatment. So if a person has a flu but they don't have access to medical care, that flu can turn into pneumonia, which will require more treatment as time goes on. This is particularly critical for chronic care patients because they need access to their care teams consistently, and they need to be able to communicate with their care teams even between appointments so that their medication adherence can be checked, and also whether or not they're struggling in some other way. Extended medical care that monitors a patient's lifestyle, their environment outside the hospital setting, can greatly enhance how effective the health care that is provided to the patient and the outcome of that patient over the long term.
Thanks, Pat. Let's expand more on this idea of extending care beyond hospital settings and talk more about these other factors that help care teams provide more effective care. Tracy, would you tell us about social circumstances?
Absolutely. So to Pat's point, we need to have advanced clinical decision support solutions, really support solutions that are capable of combining the genomic data with clinical and lifestyle data to bridge the last gaps for precision medicine practice. And over the last few decades, modernization-driven lifestyle changes have had significant implications for people's health and social well-being. So today, to what Pat was saying, people with poor health conditions are living longer at the cost of high medical care, making lifestyle-driven chronic diseases really a major public health concern globally. And as we care for chronic disease, as the care for chronic disease expands in scope, prevention and recovery is the new focus as distinct from diagnosis and treatment. So prevention and recovery, excuse me. And this demands a holistic view of the individual health, the individual's lifestyle and environmental data beyond just the clinical health record in order to efficiently stratify at-risk patients. So the evolving ecosystem of precision medicine holds the promise of looking beyond these intrinsic genomic factors and incorporating extrinsic endpoints by capturing critical data such as family history, food habits, alcohol intake, smoking, weight, salt intake, activity, all of these things, to eventually facilitate a stratified medicine practice. And interesting to what Pat was saying about type 2 diabetes. So there's been several use cases of precision medicine in its application for type 2 diabetes. And the disease we call type 2 diabetes is really an amalgamation of a large number of specific conditions that together make up a larger cohort called diabetes sufferers. And according to the CDC, 29 million people in the US suffer from type 2 diabetes, with an additional 80 million more Americans have prediabetes, meaning they are susceptible to developing the disease. And diabetes is therefore a continuum, meaning your diabetes is not my diabetes, and as such, the disease is the ideal proving ground for precision medicine. The trick, though, is being able to correlate the genomics insights with environmental, behavioral, and medical factors. So what we're saying is that your genes alone do not determine whether and when you get a disease, such as type 2 diabetes in this example, or how acutely you experience the disease. It's rather the unique combination of your genotype data and your phenotype data that must be accounted for. And so any sufficient precision medicine initiative is really only as precise as the data that it's collecting. We have to have that holistic view. And it really is a powerful vision for the future of healthcare, one that is predicated by accurate data collection and analysis, and then understanding that the individual's genome is really just one piece of that puzzle.
Thank you, Tracy. Okay, environment is our last health determinant. Syed, why don't we hear from you?
Sure. So as we are aware, environmental conditions are one of the major factors driving patient health. And it is critical that caregivers should consider and understand the environmental spectrum of a patient before finalizing the individual care plan. This may sound like an additional work for an already overburdened caregiver team, but as Tracy mentioned earlier, we are living in the digital age and already generating and analyzing a ton of environmental data and how it impacts patient life. And with the right access to this information, caregivers can significantly optimize individual care. When we think about environmental conditions, think in this way that it could be anything from natural environment, such as climate change, air quality, to built environment like means the hustle bustle and the noisy quality of noise quality of a city, highways, manufacturing and power plants, or exposure to toxic substance, or means other physical hazards, and all can increase the risk for many diseases. For example, the World Health Organization reported that people who live in areas with lower urban air quality from things like high level of ozone experience increased risk of stroke, heart disease, lung cancer, and asthma. And any and all of these factors can impact health depending on the situation, and it should play a vital role as you define the individualized care plan. The way I look at it is the genetic loads the gun, but environment pulls the trigger. That's really what it triggers to get a lot of things done. If you think about other aspects from the data standpoint, as I mentioned, there are already a lot of capture data available out there from researchers and analytic power. And it's important and critical that we bring this information for the caregiver hands so they can do some of the precision or optimized individual plan, right? Let's look at this data, for example. It's on the left-hand side, we have something which defines that what are the states or the population where we see a higher heart risk, means versus others. If you lay over the same information with the population with the higher level of smoking, you can see some trends start assembling, right? Now you mix it with, means the people who are more active versus not, and you start getting that lower data, then you can start analyzing some of more pattern and is around it. And I can go one after another with some of this data, but the whole idea is that some of this information gives you the aspect of the population where you need to focus more to get certain things done. And that really helps you figure out, means what those individualized or what the precision plan for these patients are going to be. The other way to look at it is that there is me and there is a digital clone of me, right, which is generating like roughly 6 terabytes of data in terms of genomics, in terms of my family history, in terms of the lifestyles, means Fitbit and other data I'm capturing, means the social climate and exposures and air quality and other things. So all of this data is getting generated. And as Tracy mentioned in the beginning, the critical part for any precision medicine implementation is to be able to look at all aspects of of this information, not just environment, not just genetics, not just lifestyle. It has to look at all three aspects to make sure that you're able to cover the full 360 view required to come up with that individualized plan.
Thank you, Syed. So the main thread that I'm hearing from all of you is that all of these factors in various combinations have a lot of impact when it comes to risk of diseases and chronic conditions. And it seems like that might be the area that precision medicine has the most potential impact.
Yes, in fact, to date, chronic diseases are shown to be more affected by environment and lifestyle factors than genetic ones. So that to effectively treat a chronic illness, care teams need data about what the person's habits are and what their environmental exposures are, in addition to looking at genomic factors. All of the elements illustrated in the diagram can have an impact on health, and especially on chronic conditions.
That makes sense. I'd love to hear more from you on how we're doing so far with precision medicine. How close are we to realizing this vision?
That's an interesting question. First, we must remember that precision medicine is a new field in medicine. Not only is precision medicine a relatively new paradigm, but many healthcare delivery organizations are trying to adjust to and incorporate it into their practices. But also, most of the research done on precision medicine has focused on genetics. Research is still needed on the other two factors, environment and lifestyle, but more importantly, on how these factors relate one to the other. There's still a lot of research to do. We must also remember that there's a mere correlation between genetics and health, not causation. So what changes a correlation into a cause? It must be these other factors that we're talking about. Most illnesses come from a combination of life factors. We cannot point to a single factor, such as genomics, for the cause of an illness. There's many examples of this. Someone with gene Y may develop lung cancer after smoking intensely for 5 years, while another person with the same gene may have smoked their entire life, but do not develop a cancer. So what other factors are involved there? Are there environmental or behavior factors? Perhaps. And that might be why we are still struggling to bring precision medicine into reality. In most cases, public health initiatives have had a better outcome than genomic therapies at this point. As an example, increasing tax on tobacco sales have led to a reduction in the number of people using tobacco products, particularly among young adults. Will that eventually lead to lower cases of lung cancer as those people get older? We will see. Many researchers, physicians, pharmacists, and technology gurus are working hard to make precision medicine applicable to real life scenarios, but there is a gap in the need to be filled outside of just genomic research.
Thanks, Pat. So to build on that, Syed, I'd love to hear your thoughts on how technology can help fill in these gaps.
Sure. I think in this age of digital transformation, regardless of the industry, technology is going to play the most vital role. So far, our focus has been around managing and tracking transactional information like patient appointments or patient demographics, medical records or the care provided, or the insurance-related information. But with consumerization of healthcare, now we are kind of able to capture and learn more about patient lifestyle, behavior choices, family history, and one of the key thing is to how we can utilize some of these information and how we can align this information to the caregivers. And I think technology can play a very vital role in helping caregivers align this additional information with the care they're planning for an individual patient and been able to improve the outcome. One of the key ways I think technology can really assist is that currently based on individualized care plan and using several connected devices, we'll be able to remotely monitor patients. Management of drug dosage based on genomic data, and providing the virtual care, being able to engage and communicate with patients on continuous basis, being able to provide personalized, responsive, consistent, and meaningful information to patients with remembering, keeping all three aspects of precision medicine in place. So in each communication, we are trying to make sure that the patient understand that how environmental, how lifestyle choices and genomics data is making an impact on their plan, and continue to evolve that plan to make it more optimized and precise. And these are few, but I think very important aspects of how technology can assist today.
Thank you. And where do today's clinical systems stack up with these needs? Pat?
Well, today, the clinical record, there's a real gap into incorporating precision medicine results. There needs to be a move towards data-driven healthcare, but there is already an overwhelming amount of data, and Tracy talked about the amount of data that we're expecting in the future. So what is the most influential data for that particular patient to be brought forward? There is a disparity between clinical research databases that are often used in precision medicine and the clinical systems that are used to provide patient care. Dr. John White of the Deputy National Coordinator for Healthcare IT is fully aware of the situation and says it's time to take a fresh look at precision medicine and electronic health records. What we need to do is he said, what we need to do is to bring reality into our vision. It is not just science, but the IT infrastructure that needs to support it. There needs to be a fundamental transition into a more flexible IT infrastructure to support the research data and its use in providing patient care. Another proponent of change is Eric Just of Salt Lake-based Health Catalyst. He states, practical applications of genomics in a clinical setting require robust analytics, the ability to constantly ingest new evidence, and there needs to be a clinical vision for actually incorporating that data into the clinical care of the patient. But very few organizations have all of these factors in place yet. So while the promise of precision medicine is high, there are many factors that could limit its effectiveness. The two main issues are the correlation of genomic information with environmental and lifestyle choices, and the limitations of technologies currently in use in healthcare organizations today.
And I think the other area I would highlight is that remember that healthcare is coming out of this long 10-year transition into the digital patient record system, right? And over this last 10 years, there are great solutions came out, but they are giant in size, and they may not able to kind of, agile enough. And it's not a fair expectation from those solutions to react to some of this additional information around precision data we are trying to do. And not only that, if we try to bring all of this additional information into the existing EHR solution, you're actually, creating a bigger problem than actually bringing any solution out. It is very, very critical that, you look into additional aspect and look for other clinical business solutions which can drive some agility and been able to use this information to deliver the solution at the end of the day from precision medicine standpoint.
Thanks, Pat and Syed. I know we're running a little short of time, but let's quickly hear from Tracy on where Microsoft stands in this larger movement towards precision medicine.
Microsoft has been working in the area of genomics for more than a decade, and where we come together with Mazik to be thought leaders in the healthcare industry to recognize and understand the future market needs and challenges before they appear, right, and provide solutions to resolve these problems. So in precision medicine specifically, Mazik and Microsoft have come up with some ideas on which technologies we should be utilizing. And then Syed can tell you about the chronic care management app that Mazik Global has developed on the Microsoft CRM technology to aid that chronic care and propel precision medicine forward in filling the gaps in the data.
And I think, when we think about precision medicine, it does not mean that we are coming up with a new platform or a new solution. The way we need to look into it is that we take the same guiding principle of the Microsoft technology platform, which is already delivering around, how can you engage your patient, right, to make sure that they understand this additional information and the outcome, and to focus on how the improvement in the outcome. Empower your care team to be able to focus that they have the right amount of information to create an individualized care plan, right? Means optimizing your clinical pathway based on the several biomarkers data, genetics data, and other data to be able to have an optimized clinical pathway. And then transition into the same transformation into the care continuum, that once patient is at, their house or their other locations, they're able to kind of continue to provide this additional information and continue to enhance and optimize the precision plan. And what Microsoft technology as a platform offers, right, as Tracy mentioned, Microsoft has done already significant effort in bringing and reducing the time and the cost when it comes to genetics data. Microsoft has already provided ton of information, research, analytics around, and data around, environment and other aspect of the environment there. Microsoft has developed a lot of APIs and devices to help capture, the lifestyle, information. And I think where Mazik has played a vital role is taking this, some of the advancement and investment Microsoft has made, and take this into the concept of the platform of Dynamics 365 to bring chronic disease management itself and automatic embedding a predictive methodology to be able to deliver a precision medicine using and connecting all of the input from Microsoft's standpoint. So not only that it allows us to manage these chronic disease based on the individualized care plan, but it also allows you to see a complete 360 view of the patient and been able to react. What is important is that don't consider precision medicine as a one-time shot, right? Means it is going to spend where we use this information to come up with the individualized care plan based on the precision medicine, but it also helps you predict that what can change in the environment would impact a specific individualized care plan. And that's really the full 360 feedback system is required to deliver. And together with Microsoft and Mazik Global, I think these solutions are available to customer to gain much more success in precision medicine.
Thanks, Syed, and thank you, Tracy. So with that, we will conclude our session for today. On June 27th, we will be hosting a tech talk to demo how Microsoft and Mazik Global are helping our customers to bring the concept of precision medicine to reality. I'd like to thank Tracy, Pat, and Syed for your time today, and thank you to everyone who joined. We hope you'll join us again for the tech talk. Okay.
Thank you very much.
Thank you.